I think the Premier and the health team in New South Wales have showed a real deftness when it comes to that evidence-based response and responding carefully and letting the data guide things, but importantly showing a bit of compassion. I think that what we saw yesterday from the Premier was a sensitivity that obviously, as we approach the Christmas break, the Premier was very wary of the movement of people, particularly in the northern suburbs, and the anxiety that people have about catching up this time of year and doing your family banquet and lunches for Christmas. So the fact that there was a little bit more flexibility in the movement in those zones, in people being able to go to the lower part of the North Shore, and neighbours being able to catch up in the upper North Shore, I think that does show that sensitivity and compassion, as well as continue to be guided by the health advice, and a really strong result when it comes to those daily testing numbers, which obviously is critical when it comes to containing the spread of COVID at the moment.
Yeah, the testing numbers have been extraordinary. Do you think that Gladys Berejiklian is gutsy in her approach? She's faced a lot of criticism from other premiers across the country, but she's really stuck to her guns on this one.
Yeah, look, I think all the premiers have done a fantastic job, Danica, over the last 6 to 9 months. I mean, let's be frank, public health is primarily a state government responsibility. And yes, the National Cabinet's worked okay. It's frayed a little bit, I suppose, over the last couple of months. But, I think each premier has done themselves and their states extremely proud, and based on the best health advice and the health minds. I know at Cornerstone here, our experience with the Chief Health Officer has been fantastic. They're always guided by the evidence, both as COVID's emerged here and overseas, and that advice has been as what's guided our leaders and the Premier. And yes, there's been criticism from time to time in New South Wales, just as we've seen across the country with other states and territories. But ultimately, the Premier, based on the latest advice and a really good contact tracing team in New South Wales, has sort of seen us through.
What about the cost of these border closures? We know all states and territories have closed themselves off entirely or to just hotspot zones. The Australian reporting today that's about a $3 billion blow to tourism. Are we consistently going to be counting the costs, do you think, James, until we reach a national broad definition of a hotspot?
Yeah, Danica, it's hard to sort of see much changing in terms of this risk management approach that states are entertaining with COVID until we have that proper rollout of the COVID vaccine. I mean, let's just stop a moment and discuss the UK. They've actually got the COVID vaccine starting to be rolled out at the moment. And at the same time as we've got this other strain that they're dealing with and Tier 4 lockdown. So, we're going to have to continue to be patient. Another 6 to 9 months, we could see states continuing to sort of have this risk-based approach when it comes to lockdowns and occasionally putting up the borders to help manage this, because ultimately states are responsible for public health. And we know we've got the cautionary tale in the case of Australia when it come to the unfortunate situation in Victoria and the secondary outbreak there. Premiers need to be guided by the latest health advice. They're not going to let this thing get out of control. And to be frank, when it comes to long-term economic costs, the key is containing this as best as possible.
Are we becoming less, though, like a federation, James? We've seen consistent criticism. Each premier's been criticising each other's responses. We shut down every single time there's an outbreak. National Cabinet, they can't agree on a definition for a hotspot. Are we becoming less like a federation?
We're certainly seeing that competitive federalism coming back as we hit Christmas, aren't we, Danica?
Yes.
Look, I think the National Cabinet served us really well early on, where we needed that rapid response and to keep the global supply chain open, to manage that health risk where it was most acute. That really did serve us through. I think, unfortunately, we probably lacked a little bit of leadership to be able to continue that. I think it's a shame, Danica, the National Cabinet hasn't been taken up for a trot when it comes to other aspects of economic reform and tax reform. To be frank, the productivity and population challenges we're going to see over the next sort of months and years, I think the National Cabinet, it started off really well. Yeah, it doesn't really feel like it's sort of ending the year as well as it started. I think we do need to have a real regrouping early in the new year about that, because there's some real benefits. So I think if our premiers work together really well, and I think we've seen some evidence of that strong bipartisan leadership. I think Daniel Andrews and Gladys Berejiklian clearly enjoy a pretty strong relationship. I think both sides have resisted criticism when there's been opportunities to do that, and that's kind of worked well. It's probably been, we've seen Queensland's been a bit parochial and vice versa with other states and territories. ultimately, as we say, public health is a responsibility for state governments, and they're going to focus on their populations and economies first and foremost.